everyone, this is Annie Messinger at BerryDunn. Welcome back to Fresh Perspectives in Social Work, a podcast produced by BerryDunn in our state government practice group. Today, please help me introduce our guest, Laura Hunt, who is the state of West Virginia's Director of Office of Quality Assurance for Children's Programs. Hey, Laura, good morning.
Good morning, Annie.
Thanks for joining us today. In today's episode, we'll be talking about some lessons learned from continuous quality improvement implementation and what makes driving meaningful change in the lives of children, youth, and families the most effective in the state of West Virginia. So let's go ahead and dive right into it. First, we're going to talk about framing CQI and building the culture of that continuous quality improvement. So Laura, my first couple questions for you might be, what is CQI and why is it important from your perspective?
Yeah, sure, Annie. So CQI, and I'll try to do my best today to not get stuck in the world of acronyms, as we often do in state government and many other facets of this type of profession. But CQI is continuous quality improvement, and it's just a fancy way of saying, how can we look at data, statistics, and information in order to make sure that the strategies and plans that we are taking are working to accomplish our goals and help the children and families that we're working with.
I like that. And I think you've mentioned before that making the data human really helps shape it. And how did you become interested in this work, if I might ask?
Yes, no problem. So I've always been sort of a problem solver. I really like to figure out how things work and why they work. So that's why I ended up working in epidemiology. I originally worked more on the public health side of things, with maternal, child, and family health work, and then have moved over towards working more with behavioral health topic areas as well as social service topic areas. So as you mentioned, I do like to often talk about and help people realize how we can make the data human. People will often say to me, I'm not a math person, I'm not a data person, so I'm not really sure what to do with this. And I always kind of giggle because I was never a math person either. And they always give me a funny look because, I'm the one manning the statistics. So it's like, is this a good sign? But I think you can find ways, like even if something's not your favorite thing, you can find ways to make it related to your work, because the data really is representative of the humans and the work that we're doing. And so it can help us further understand what's working, what's not, and how we can further improve or see that our work is helping families thrive and meet them where they are. So I always like to point that out and just really talk to people about, well, what is important to you about your work? And we usually can relate it somehow back to the data to where they can further strengthen the work that they do.
That's great. I'm sure lots of listeners can resonate with what you just said about the importance and the interest to a certain level. But that's a good transition into talking about the stages of implementation for CQI at the state level. Looking at some key competencies, like where would you start? What goes on first in the stages?
Yeah, so depending on where you are, so like for instance, if you're starting from scratch, it's always important to identify the scope of your system or the scope of what you want to work on as far as your continuous quality improvement plan and implementation. So like for our group, we wanted to set the scope around more related to the children's mental health system, which intersects commonly in West Virginia, as well as we know in the nation, with the child welfare system as well. But we also wanted to make a system that could allow for early prevention, allow for families to engage easily and navigate easily with the mental health system without ever having to be like social service involved, etc. So, again, for us, it was really understanding that our system was from the time of screening up until making a decision about what is the best service or placement for that youth if they were to need placement. So being able to identify data elements all in between to really help look at different levels of indicators, but also think about the child and family journey and just how different stages of that process influence different barriers that families might face. Considerations with making sure that providers and families are aware of services, how to connect to them, and how to go through any different processes, and really going all the way through to how that influences outcomes. Like, for instance, whether a child can stay and thrive in their home and community, and have that quality of life that we're desiring for them. And so that often involves scoping out not only the indicators that you think might drive the system and scope that you've set out, but also understanding who are the key players or partners that you need to work with for this. So like for us, it was very important because we know that there's a lot of involvement and engagement with the school system, with juvenile justice, with our probation services, as well as some of our key more internal partners to the Department of Human Services in West Virginia, which is our Bureau for Medicaid Services, our Bureau for Social Services, as well as our Bureau for Behavioral Health. And then our close partnership with our Department of Health, which has the Office of Maternal, Child, and Family Health in it, which works with wellness visits and just really connects the full spectrum for this child level journey when families are seeking services for children who have serious emotional disorders, and allowing them to be maintained in their home. So does that answer your question, Annie, or is there some additional elements that you'd like to dive into?
Well, you had also talked about that qualitative companion evaluation. Do you want to talk a little bit about some of your external partners with some of that and the sustainable CQI processes?
Yeah, absolutely. So yes, that absolutely is another component. So as part of our CQI process, we have, of course, what I'm going to call our internal key performance indicators, or KPIs, that we look at to see what's working well or might need adjustments or for further strategic planning. We share that with our partners. And then in addition to that, we know that not all of our internal data will be able to give us all the answers we need to make sure that we're serving people in the best capacity. So we do have our qualitative companion evaluations. We have one that is done through Marshall University, and one of the key components and scope of our system is West Virginia wraparound, with the goal of having high fidelity wraparound program to ensure that children and families, quote unquote, can receive that wraparound service around them to be able to support and maintain them in their homes. Mm-hmm. So Marshall's evaluation with that helps us ensure that we are upholding high fidelity to that program and that structure. Mm-hmm. We also have an evaluation through West Virginia University, and that is a more systematic evaluation that reaches out to providers and families and children, and gets more of direct perspectives about system navigation, system use, so that we can understand both from a utilization perspective as well as a direct perspective from individuals.
That's great. That's great. External partners are so key in so many areas when it comes to CQI. And talking about those key performance indicators, let's talk a little bit about how you developed a plan or that annual plan or that annual review or what have you. Like what, simply put, where do you start in developing a CQI plan?
Yeah, so I'll say depending on your system scope and where you want to start, it can be as simple or as complicated as you want to make it. But if you want to start off simply, you can just get some key folks in a room and start asking thought-provoking questions about your work, such as what information do we need to advance this work? What is helpful? If you have data visualizations to look at, I'll say when West Virginia first started this process, we started with data visuals as simple as just looking at, for our current programs, what are the number of kids utilizing the service? How old are they? What gender are they? How many kids do we have utilizing residential services? And what do the trends look like for that information? So we did include some visuals like that to start out some of our conversations, again, in West Virginia. And so it's really important to have, what I would call a safe space in reviewing the data, understanding it, and asking each other questions, because everybody that you're trying to have at the table as far as key partners and to advance this work may have different perspectives and different levels of expertise. So it really gives you the opportunity to learn from each other even more, but also to look at things a little bit closer and say, okay, you might understand this data, but I don't. So can you tell me what you're seeing with it? Or, maybe neither of us can really see, okay, we're not really sure what's going on here. This is not what I would expect. And so talking through that, and if there's caveats in it, and just continuing the questions about what do we need to know about our population that's served and how they engage in services. So, when we first started, one of the questions we had was we had set up an assessment pathway to try to really streamline and help with system navigation for families. And so we wanted to understand what the barriers were to that, and if families were not continuing in the process, why. So one of the first things that we focused in on collecting is information about people not continuing with the assessment pathway process and why that was. And by doing that very early on and looking at data frequently, we were able to identify that there were a good bit of families that believed that they would not qualify for Medicaid. So they felt like they couldn't get services for their kids or their child because of that. And at the time, there was a limitation as far as income related to that. But given some of that feedback on the data, West Virginia was, I believe they're still the only state in the nation that has what is referred to as a 217 waiver, which allows families with children who meet clinical criteria for serious emotional disorder to apply. And if they meet that criteria, then regardless of the full family's income, I'm putting it a little bit simpler, but regardless of the full family's income, if they meet that clinical criteria, then they can get the service. So it was a great opportunity to expand the work to families who really needed it, that may not have gotten the intensive services they needed otherwise. And again, that was all by just starting to answer very simple questions about our population and looking at the data very early on, even as we were trying to understand it.
That's great. And the safe space, the, transparency, the no dumb questions or no wrong questions. I like that format and that approach because some people think, not so great data is bad. And I think that what we've talked about is any data is good because it's informative and it helps create change where needed, right?
Absolutely. Yes. And I'll often joke, people will say, okay, Laura, dumb question. And I'll say, there is no dumb questions, but also, I think it's smarter if you're asking questions to begin with, even if you think they're dumb, because that means you're paying attention and that means you're learning. So I think that's a really valuable skill to be able to put yourself out there, even if it feels uncomfortable, to ask those questions and really to be passionate enough to ask the questions to try to figure things out. And I do want to give an example, as you mentioned, with there really isn't. I don't view it as a negative thing if the data is not necessarily where you want it to be, and I think that's extremely important when you start reviewing data. I know a lot of folks in West Virginia were nervous when we first started the data because they were worried that they could get in trouble or something like that if the information didn't show us what we wanted. But that's the point of continuous quality improvement. If you don't look at the data at all, you're not going to know what to do next. And so that's why often I say it's exciting that we're at the point of being able to take next steps, like looking at outcomes data or whatever it may be. And even if the results for certain topics aren't exactly what you want them to be, maybe the outcomes aren't as strong as what you'd like. I think sometimes that's okay because it gives you a starting place and it gives you the opportunity to plan for strategic change, know what's happening, and be able to do better. Because to be quite frank, if you don't know that something's happening or is not happening, then there is no ability to change it. So I view it as a very positive thing, even if the results can seem negative to begin with.
Absolutely. That's great. So let's talk a little bit about establishing or expanding that data collection to meet the needs. Like, where do you start, but were there standards? Were there certain timeframes that you look at for reaching data? Like, what's the approach to that? Or what was your approach?
Yeah. So I think a lot of this goes back to that system scope and what you're trying to look at. You may have some things already established, whether it be through federal reporting or other reporting that you're already required to look at. And sometimes that's a good place to start, just to say, okay, this is where we are now. What are our additional questions that we want to understand? And then you can start to talk through what the different elements are that are available in the data. Or if you need to expand your data, then you can have those discussions as well about how to either enhance your current systems or build new systems. It's some examples of this whenever you're working on data systems. It's always good to look at your data quality. So if you have a high percentage of missing data, that's something that will be important to address, because data quality is really key. And maybe I should take my previous statement back, that, I guess there is such a thing as bad data if your data doesn't exist. Let's put it that way. So I think that's where it becomes really important to make sure that your data quality is the best that you can make it, making folks aware if there's a key indicator or a key field that's not being filled in. That'll be a good place to start, is to work on that, because if you have the information, then you're able to plan accordingly based on those results. Some other things to keep in mind as you're building or adjusting data systems is it's very difficult to analyze open text options. So options where people can just type in a response. It's always better to have drop-down options, multiple choice, check all the above. That way that data could be analyzed in a clean and categorical form, so that you're able to pull it out and visualize it and understand what's happening with whatever measure you're trying to understand. One of the things that we started with, but we've been trying to work more and more on in West Virginia, is prioritize key performance indicators. And so this is a subset of your key performance indicators that are considered prioritized, and is really meant to keep a pulse on the quality and outcomes for children overall, or whatever the key outcome or indicator that the goal of your work, that you're trying to focus on.
That's wonderful. That's great. So When you're developing teams or processes for reviewing the data, what does the CQI flow of communication look like in West Virginia? Like, where does it start?
One benefit of the way we do things in West Virginia is we do have my office, the Office of Quality Assurance for Children's Programs, which again is dedicated to this work. And I think that's been really crucial because we are housed in the Office of the Cabinet Secretary for the Department of Human Services. So we do have the ability to take a more centralized approach and break down silos, potential silos between bureaus as well as different key community partners. So that's really helpful. But it's most important to make sure that stakeholder and internal partner collaboration and communication is open, so that folks can start to understand each other's work, and that information can flow up to leadership. And again, my office helps with that by communicating both more, I would say, like in the weeds or the detail level, and then able to translate that and distill it a bit so that leadership has that key information to help make the decisions and drive the prioritization of the work. As part of this, we do have a schedule of reviews, and so with that we have developed different levels of reviews. So we have monthly meetings with the different bureaus and work groups, which include some of our key stakeholders. So for instance, we have a work group monthly on discharge planning. And we have a work group around the qualified independent assessment, which is a process for youth with certain risk factors to identify their clinical needs and help provide a more objective recommendation for those children. So those are some of our key prioritized areas, which we have, again, work groups for. And then in our bureau level, we have review of specific programmatic data. Like, for instance, we review information about the West Virginia wraparound program and indicators of fidelity. And so those are much smaller groups that we're able to really take a deeper dive into the data with, have those discussions. Mm-hmm. And then we regularly meet with leadership on a regular schedule, but as well as needed to raise elements, like as we're reviewing the data, if there's an immediate need or something they need to become aware of. And then we also have these much broader meetings that include leadership, include programmatic leads and staff, to where we can all get together. And this has evolved over time. When we first started, we started having some of those conversations about what is important to you and understanding it, and starting with utilization and demographic data. And then it's since evolved to where more recent conversations, like for instance last week we had our quality committee review with our larger group, and we're starting to be able to review a lot of cross systems data. So looking at that child level journey when they're going and navigating the system, navigating programs as well as outcomes. So that's been really exciting to get to that level. And then it really opens opportunities for folks to talk about different initiatives that they're working on. I know I heard some things about some of our homeless population or our transitional living population that different folks are working on. It just really helps eliminate the silos in our work by being able to have, some of these side conversations and opens up the door about, okay, this is what we're seeing with our kids. So let's talk about all of the different things that can influence that. So it helps open conversations that are much expanded beyond the data. So I think it's an excellent opportunity to have those venues where folks feel like they can talk and ask questions and, again, really strategize what we can do to further improve and what's working well.
That's so great, Laura. Sounds like a really good process review team and full engagement in the buy-in from program managers and especially that executive leadership. That's great. Well, I think we've come to about the end of today's episode. So I just want to thank Laura Hunt, Director of the Office of Quality Assurance for Children's Programs with the state of West Virginia. And Laura will also join us in our next episode where we dive into some of those tips and tricks of getting started to implementation, processes and feedback, critical connections, and provide some examples of the suite of reports and that evaluation piece. So thank you again for joining us today, Laura, and we will talk soon.
All right. Thank you, Annie. Bye, everyone.